feel like top billing always goes to, what am I going to pack in my hospital bag? What should I wear during labor? But the main thing you need to learn about your upcoming birth is how to make choices when you are actually in labor or going into labor. Now, this isn't to say that what you wear or the baby swing that you buy or how to push or all these different things aren't important. As a labor and delivery nurse for 20 years at the bedside, I saw patients who were absolutely not confident at all at making their choices. And that is what causes birth trauma. You just not being prepared to make choices. And I got to tell you, we are just throwing choices at you all over the place in the hospital. And so learning to make those choices is a big win. I am so glad that you are here. Now, I think one of the ones we don't talk about is the last one in here, so make sure that you stay tuned. And this one is one my husband absolutely hates. Now, evidence-based birth is something that gets a lot of attention right now, right? Like maybe we haven't paid enough attention to the studies for pregnant women or done enough studies for pregnant women for a long time. I agree with all that. I think it's important that we look at the data. However, just because the evidence points one way or another in a study, studying a wide swath of the population, hopefully, if it's a good study, that doesn't always mean that that applies directly to you. And that's why you have an expert in the situation. So while I'm a huge fan of being aware of the studies, having a provider that's aware of the studies, I want you to know that sometimes you're going to make the choice that is not exactly evidence-based because it works better for you. And I think a lot of people don't talk about that. Is that something you've heard about or something you've thought about? Tell us down in the comments. Okay, one of the first things you can do to feel confident about your birth choices in labor is to get a firm foundation for your birth. Now, you are not there to put in the electrical or the plumbing. You are literally there just to lay the cement, to know what is going to happen in your upcoming birth. Now, a lot of you might be thinking, Hillary, my birth class really only covered pain management, and I see that so much online. So let me tell you the things that your birth class should be covering or things you should be aware of before going into labor. You need to understand third trimester testing because far too many births are going off the rails at that point. You need to know how to labor at home in early labor and do it safely. You want to know what to expect from admission from the hospital. And I got to say that this part scares a lot of families way too much. You want to know common interventions and supplies, and this can really freak people out if you don't know things that we commonly do in labor and delivery. You want to know all of your pain management options, including medical ones and natural pain management. You want to know what to expect at an induction. And that goes for the people who are planning on an induction and those not planning on an induction because you just never know what's going to happen. You also want to know what might happen during a C-section. Again, even if you're not planning on one. And what happens at delivery, both vaginal and the other kind. You want to learn how to manage your postpartum stay and get the most out of being at the hospital. And then you want to know what to expect when you go home and how to both stay safe and thrive as a new parent. And you're sitting there thinking, Hillary, did I need to take this class when I was in college? And I'm here to tell you, you are just getting the foundation. So you do not need to know the chemical makeup of oxytocin, but you do need to know basically what it is and how you let it flow during labor. I think a good birth class just takes a few hours, and I really think a good birth class should involve your partner. There is one that I recommend. I'm going to put a link for it down below. Remember, studies do show that birth classes decrease birth trauma, decrease C-sections, decrease induction rates, and decreased assisted deliveries, which means forceps or vacuums. Okay, the second one is to remember what your job is. I have to remind myself about this all the time. It is not your job to understand fetal monitoring. It is not your job to read all of the different studies of all of the things that you might have with your upcoming birth. These are the reasons that you are hiring an expert. It's why you have a doctor, you're going to have nurses in the room when you deliver. I like to give this example. I know nothing about tree trimming. I love to grow flowers, but I don't know anything about trees. So I hire a tree trimming expert to come and trim my tree so that it stays upright during our crazy monsoon season here in Phoenix. I am not out there telling him what to do. I'm out there telling him what I want the tree to look like and mostly to not let it fall on my house. And hiring a doctor is no different. They are just a very educated expert in your upcoming birth. And I want you to remember that their job, your provider, your midwife, or your doctor, is not to make choices. And I would say in almost every single circumstance, very rare. I have maybe seen 2 circumstances in 20 years where the doctor actually really needed to make the choice for a patient. And usually that happens in the operating room. And by golly, you want them to make those choices on the fly during those types of situations. Now, sometimes doctors think because they get to make the big choices every once in a while, that they also get to make all the other choices. They'll say silly things like, we're going to induce you at 37 weeks versus, hey, I think we might want to consider an induction at 37 weeks. Sometimes they say, we're just going to section her at 8 if she doesn't progress. No, we are going to re-look at things at 8 and see if a C-section would be what she wants to do. Or they'll come in your room and they'll say, we're going to break your water. They don't discuss why they're going to break your water or, again, ultimately let you realize that breaking water is your choice. In fact, the exam is also your choice. You get to make all of the choices in labor, which is why feeling confident during labor and delivery is going to be a big win. And in fact, when I was titling this article that I wrote on my website, I'll put the link down below if you want to check out the full article, I actually also came up with learning to trust yourself to make choices in labor and delivery. I think it's the same thing because when you feel confident, you trust yourself to make choices like this. And I absolutely want that for you. I want that more than almost anything else in labor and delivery. So when we say, remember what your job is, number one, it's to get the foundation like we talked about in the first one. And the second one, your job is to make the choices. It's not to know all the data, all the different things. That's why you've hired your doctor and they can give you that information for you. That's their job. Now, one other thing that I think it's super smart to be doing as you're heading into this is make sure that you know what you would like if all things are perfect at your birth. To start to know, I'd like to avoid an epidural. I'd like to avoid an induction. Or maybe I would love to have an induction because it just seems easier for me to plan on something. So getting those choices can be really helpful as long as you realize that that's not really a plan. It's just helping you think through what you would like if everything turns out perfectly, which, by the way, when does everything turn out perfectly? If you've had something turn out perfectly, tell me down in the comments. I have a whole Birth Plans Made Easy series that you guys can join below. It's totally free. Okay, the next one is to realize that informed consent isn't everything. Now, informed consent is very important. Remember, informed consent should include the risks, the benefits, and the alternatives. Now, informed consent, where the provider actually has to chart it, really only happens on inductions, C-sections, and epidurals. However, they should be getting consent and helping you to make those choices on things like water breaking, using antibiotics in labor, things like that. Now, let's pretend your provider is saying an induction of labor would be good. Let me tell you what an informed consent might look like. And as a note, only doctors or midwives give informed consent. It's the person doing the order. Nurses don't make orders. It is not the nurse's job to get informed consent from you. So that informed consent might look like, I think perhaps we should induce you. The baby seems to not have enough fluid around her, and that can be a problem as they stay in the womb, including possibly stillbirth from the cord getting squished. You said that fetal movement was seeming less lately, and that has me concerned. However, there is risk to an induction of labor, including increased pain, longer being in the hospital, and an increased risk of postpartum hemorrhage. We could also wait if you want to prefer. I could order an ultrasound in a couple of days to check again. Either way, I want to be sure that you're doing your kit counts. Now, that informed consent is a very simple statement, and then the ball is in your court. I think far too many people think that after an informed consent, you're in a multiple choice exam where you pick yes or no. But this is actually an essay exam, a verbal essay exam, if you will. And that means it is your chance to ask questions. Your provider has given you the basic overview of things that might go wrong or things that might be different with an induction of labor. However, it might not even be what's important to you. You might be wondering, am I gonna have to have an IV if I get induced? And that might be important to you. And that is not something that they would likely include in informed consent. You might be wondering how long you're going to be there. They do say that it'll be a little bit longer, but this is your chance to ask the question. How long do you think that I'll be there for? How long should I prepare for? You might be thinking, I really don't want to have to get an epidural. Does your provider believe that you getting induced is going to increase your chance of needing an epidural? Now, of course, a lot of this is guessing games based on their experience, but a lot of medicine is guessing games based off experience. And it's fine for you to ask your provider these types of questions. Now, as you ask your provider these types of questions, you're going to notice that you're using that foundation of knowledge that you got, knowing that sometimes an induction requires an IV. You're going to use the fact that you went through a birth plan and you knew that you really didn't want an epidural if possible. And so you're using that to ask questions as well. You're using all of these different things to get the information that you need in an informed consent. Because I have to tell you, the initial informed consent is going to be sort of a blanket statement that they tell everyone. And then it's sort of your job to tailor it to what you need to know going in for your induction. And by the way, if your doctor is bringing up an induction, I have a whole induction checklist of things you should be asking your provider before you get induced. I'm going to put the link for that one down below as well. One other thing here is sometimes when providers give patients choices like this, I feel like I'm sort of at the used car lot, like he is pushing a price to you and then you got like there's sort of pressure to accept it or walk away. And I'm here to tell you it is fine to tell your provider, hey, why don't you go in and see your next patient? It's something we'd like to discuss. I'd even like to call my mom. I'm here to tell you it's totally fine if you want to call your mom. A lot of us have not made healthcare choices for ourselves before we go into labor and delivery. So if you want to call your mom, you want to call a friend, you want to call your doula, all of that is totally fine. Don't feel like you have to make a choice right away. And if your provider, in the very rare instance, feels like you need to make a choice right away, they will probably voice that concern at that point in time. And in fact, you may even be able to say, hey, we want to go home for a couple of hours, kind of sit with this choice, see how it feels with the choice, and then give you a call back. Would that be okay? And all of these things should be absolutely fine with your provider. This is a big choice. It's going to change the path of your next few days, and you want to make sure that you're making it right. Now, do providers say, would you like some time to think about it? Sometimes the good ones do, but a lot of them kind of sit there like the used car salesman, like, are you going to accept my offer or not? And I'm here to tell you, you can say, hey, chill out, give us some time, just like you do at the used car lot, which, by the way, I hope I never have to buy a car again, although that seems unlikely at my age. And let me say that you can also keep asking questions. So let's say you have the provider go to their next patient, they come back in the room. Keep asking questions. If you're still not feeling clear about your risks and the benefits and what it's going to look like as you go into the procedure, because that's something that I feel like a lot of people complain about online. When your provider gives you the informed consent for an induction, they don't really tell you what the induction is going to look like. That's not so much part of an informed consent. So I would encourage you to ask your provider more about what the actual procedure is going to look like. That'll just give you a little bit more information. Of course, if you took a great birth class like the online prenatal class for couples, you'd already be prepped in a lot of those things, but more information for your provider about how they're planning to do it can always be helpful for your situation as well. Okay, here's the last one, the one that my husband absolutely hates, and it is that you can change your mind. My husband hates that I love to change my mind constantly, but it is an option for you, and it's not something we bring up frequently at the hospital. I actually have a whole video on the secret keys to a great labor that nobody talks about, and one of them is the fact that you can go home. People don't talk about it. Now, is it always safe? Absolutely not. It is an option for anyone at any time. I guess if the baby's crowning, I have had a patient say she wanted to go home, and I probably wouldn't recommend it at that point. But really, most of labor and delivery, especially these long processes, you can say, I don't like the way this is going. I want to go home, and then have that discussion with, again, the risks and the benefits with your provider before you make that ultimate choice. You get a Foley bulb put in and you absolutely hate it for your induction. Say, this isn't working for me. What else can we do? Ask to change the plan of care. That is your right as a patient. Now, that isn't to say that an early induction of labor might not come with some pain. That might be unavoidable, and you have to be realistic about that. But if you feel like you're going down the wrong path, I don't think it's ever bad to be like, hey, can I go home? I'm just not liking the way things are going. And if anything, I think that opens up a door for you to have a discussion with both your nurse and your doctor or your midwife about how things are going and what you can expect moving forward from the point that you're at. Now, if you're thinking, Hillary, I would love to learn more about choices, I have a video that I'm going to put up above that talks a little bit more about this topic that I think you'll really enjoy. Remember, you got to have a good foundation. It is your job to make the choice, not your provider. Make sure to ask all the questions you want about your informed consent, and you can change your mind. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared and confident, not scared, for your upcoming hospital birth.